Guys, stop freaking out. This is not milia. You see, these are milia. You can see the dots here are scattered a bit more randomly and they're less uniform in size. These bumps are just your oil glands, aka sebaceous glands. You can see there's a lot more symmetry here in how they're placed and also their size. Now I know a lot of you have these for as long as you can remember and that's completely normal, but why is it for some of you these have just randomly appeared? You see, we're gonna have to blame aging for that. As we age, we make less collagen, less elastin. As a result, the skin under the eyes thins and these sebaceous glands, which are always there, just become more noticeable. Secondly, the bone around the eyes thins and we also have fat pads under the eyes which can also migrate downwards. As a result of all of these factors, this can make these glands look a lot more obvious. And of course, the biggest reason, sun damage. Now, you don't need to panic, you don't need to do anything about them really if they're not bothering you. However, here are some tips for those of you who want to improve their appearance. Protect your eyes from the sun. Yes, sunglasses, but also make sure you're using sunscreen around the eyes. Chemical sunscreens are less well tolerated around the eyes because they might burn or sting your eyes, so I tend to advise a mineral-based sunscreen. For example, this tinted mineral sunscreen by Dermatology is great. Secondly, you want to try use a retinol-based eye cream in that area to really help boost that collagen production. And this is a good choice because it has a lot of hydrating ingredients in there to allow you to tolerate retinol, which is a strong powerhouse ingredient around the eyes. However, it may be the case some of you can't even tolerate that around the eyes. So for those of you, I'd recommend a peptide-based eye cream. For example, this one by Naturium. The peptides will again help with collagen production, but they will also help with hydration around the eyes. And when the skin is hydrated, this will improve the way the light scatters and reflects around the eye, which will make these glands less obvious. Remember to be patient and give the creams at least 4 to 6 months to work. If they're not working and you want to go a step above skincare, then you can think about laser resurfacing or gentle chemical peels.